Thank you, Madam Speaker. My question is to the Minister for Health. Minister, the North West COVID-19 outbreak has been devastating for the families of people who died and hugely affected the 5,000 people who went into quarantine, as well as North West businesses and customers who were locked out of trade. It's not every day 2 hospitals are closed and the Army is brought in to clean them. With Tasmania now on the cusp of easing some social movement restrictions, it's more important than ever that we have 100% confidence in our ability to quash a COVID-19 cluster before it becomes a tear-away outbreak. The Director of Public Health handed you the report with 17 urgent recommendations that need to be implemented to prevent another outbreak. These include systems to ensure education for staff, consistent infection control standards and protocols around moving patients and staff. I recognise there have been acceptance by you of the report and conversations about progressing actions. But Minister, while the easing of restriction is being actively considered, Tasmanians need reassurance that hospitals can respond effectively should a COVID-19 bubble up, as the Premier has just said, in another place. Minister, can you please tell us when you will be providing the timeline of delivery dates for each of the specific 17 recommended actions?
Good question.
Thank you. The Honourable Minister for Health.
Thank you, Madam Speaker, and I thank the Honourable Member for her question, and I too would like to pass on my deepest sympathies to those friends and families of those people that have been lost in this outbreak, and also my best to that community and the healthcare workers at those hospitals. I know it's been an incredibly stressful time, and I know that many of those staff have been working incredibly hard and are continuing to work very hard to get the full operation of that hospital back up and running. With regards to the recommendations, as has been outlined by the Premier, the Secretary is currently working through an implementation plan for each of these. Many of these, as has already been outlined by the Premier, have already been started to implement, or we have plans around how we can implement that. I note that we have a very large THS within Tasmania, and we also have quite different sites. I know, and having spoken to many of the managers at the different sites we have across Tasmania, the way we implement each of those recommendations will need to be bespoke for those sites. So while we will want to have a consistent approach, for example, around screening of staff and other patients coming into sites, the way that we do that at the LGH will be very different to the way that we do that at Beaconsfield or at Queenstown. And so we need to work with local leadership to ensure that the measures that we implement have the infection control outcomes for each of those. Now, I know that the Honourable Member received a briefing this morning from the Secretary of the Department. I understand that this was discussed in detail in terms of the recommendations, so I fully commit to implementing each of those. Once I have received an implementation plan, I will be more in place to be able to provide timelines that we are working to. However, I'd like to reassure both the Honourable Member and also members of the House that I'm not awaiting that plan before measures are starting to be implemented and already have been implemented. We know that we are still in the early stages of coronavirus and the impact that that's going to have on our health system. So while we continue to progress planning across escalation on each of our sites across the system, these recommendations are being further embedded into those escalation plans to ensure that they are there. We're working to ensure, as the Honourable Leader of the Opposition had said, to ensure that these are also applicable to all healthcare workers and all staff on these sites, because we know that we have risk at these sites because they are high-risk locations. So I can assure the Honourable Member and I can assure the House that this is an extraordinarily high priority of mine and the Secretary's. When I have further information to provide, and hopefully I will in coming days to be able to provide an update, I will do that. And I can assure Honourable Members that I will get these implemented as quickly as possible, noting that many of them need a lot of preparatory work to ensure that this is not a ticker box exercise. I want these measures to be implemented in a way that have meaningful infection control outcomes.